Echekwebe ego na-adị aga m echekwebe ego na-adị People's Club olezi n'obodo ndị People's Club odogwu igiligi adagbukwa n'anya odogwu igiligi adagbukwa n'anya nnọkọ si adị igiligi adagbukwa n'anya igbe anyị olu enu n'omume People's Club, mama, People's Club, amatanu. Amwa kule sabwadi nobele mwanu. Anabajaka kumwajezeno. People's Club, ikudezeno. Na mwamora yini akwajozele mwa. Anye kenebese national president yani. Prince Dai, ike tumezote. Ese onima wa. Namichi. Are no konko sobilino. Atorita senoma. First Vice National President na People's Club nke Nigeria. FFPC nwagbo Osofia 1 na Nofia. Second Vice National President People's Club nke Nigeria. Odinkenke niile. Chief Jalanya Sobilino Onikuku 1 na Nnewi. People's Textile. Like Joseph Odemena Wanku. National Law na People's Club nke Nigeria. Onye ọma n'ijizuru ejizuru. Chief Augustine Ilodibe Ogbueki Nnanerugo ekele ndị ụwa. Chief SM Okonkwo ese dị ọya mma n'alọ. National Petrol Chief Enweze Sobilino Igwe Umuoji Urukotozi Akụ mgbawara ụgbọ. Chief Mwa Obiora Okomewa na ndị isi ọgụ isokwa na ndị National Petrol na ese ọchịlọzụ ha na ndị isi ọgụ obele nwa dị anyị mmanụ. ọbụbụa etudo na Mbaise chairman working committee na People's Club nke Nigeria. Udeopaga na Onitsha igwe eze dị ọra mma nna ochie ekene Tipisi eze nwa sobirinu ezi nwa si obejenu eze nwa n'ikitenu eze okoko wa n'ọba Tipiriti keluba onye ọma n'ise Asati ati Barista I Ekwereku Assistant National Legal Advisor Ifedi Orama Onitsha anyị ekenebeze Honorable Charles Akunwata Modern Akụili Ọjiọra Omenamkpo Dọjana-Sotodiri ezi nweta bụ isekete National State anụ asọrọ ọra okwu onye asị n'ọrụ ya ka a na-asọrọ n'ọrụ FAC ọfụdụm ọfọdụm Chief Osikabe Okeke eze nwa mmadụ one na Nnobi onye ọma n'obodo ndị Badụ na mmiri nwoke dị mma dipteti n'ọrụ gasozirinu nwa si ọka dịkezenu Dunu Ọtụgbo one n'ọkedi egwu ịga eweta bụ azụ Igbo n'ịga iwolo bịanụ onye dị n'oge n'ibụtanụ abụ igwe oge ịga one ụmụ ojii igburu oke oyibo nwata ibe ya anyị ekenebeze Chief Izundụ eze anyị ọba one n'Okedi Honorable Ifeanyichukwu Enemchukwu the Honorable Speaker Anambra House of Assembly ọba one na ọba Chief Edmond Ikane Youth onye ọma ka ya bido egwu n'enu sekwe m ụdekene ezi nwa m amụcha obodo ichie si n'obodo isi mmiri wa n'ụmụ ojii. SP ọfọdụme Alhaji Ichie Ọbụma n'Ezi. EO Udeze Eze Udowa na Mụ Ifeke. Anyị erute n'Ọnịcha, do n'Ọnịcha ka anyị si na-ejenu. Senu mmadụ na-abụ n'ụwa. Chief Dona Ezekaya Ugwuze, Ichie Ọbụmkpọkọ One n'Ọba. Chief Jesse Okafor, Chairman na Babrand, Ichie Chinyere the Lord Chief Uche Chibudemeno. Worry mmadụ na-ekwu mmadụ ka anyị chebudebe n'ụwa. Chief Okoye Warri Branch Chairman People's Club na Nigeria. Ndị mmadụ na-akpụnụ akwa akwụrụ. Chief Anyemena Ike ọkọ na mmadụ nọkwa ya. Prince Amadi President Port Harcourt Branch. Ibadan ka anyị na-ejebi na-ejenu mmadụ ka anyị so na-ejebe ndebe obodo ndị niile. JM Iloaki Ichere One Okwu n'ike Uwe Dabefu na mba. Josu mmadụ sokwa na-ejenu onye ike ọcha anyị n'oge n'obiri nụ. Just right, Chairman. Prince Dr. Eke, Metro, Port Harcourt. Anyị si just na-edebe nụ na Bauchi nụ. G.O. Udemezue, Chairman na Bauchi. Body ka anyị na-abata gị n'ọrụ. Chief Mbadogharị abụ n'ọrụ. Ibe anyị kenu ke niile eluji onye ogologo onye abụ n'ọrụ. Chief G.I. Mba Chinyere Igbo Ugochukwu Eze Chukwu gọziri. Engineer Chief Anyeche, Chief Engineer Onitsha Local Government. Madam Vero Ikeli, People's Queen, Ugobete, Chief Onyudo, Petroli, Nwansi Obideze, Emmanuel Okafor, Nwanne Eliakụ, Kareli Adeli Onwebano, Right time. Everybody will forget. Apata one na not you. I got you. You were big. My kilo live. Ọ̀nà lẹ́yìn. People global Americano. Nkwari wele mata mibali na lolo Americano. Kaduna kani na batano. Mmadụ nọkwa ya. Chief FM ọkụrụ. Chairman and Group Brand. You said he's over alone. Another no Anambra State. Chairman Asabanani Nekenu.
Yeah, I gotta go clean up my glasses because I need to do that. Gotta fix this glass real quick. Okay, here we go. It's time. Let's make sure that everything is working right. Oh yeah, I'm just jamming that Osadebe for you guys. I hope you all listen to Osadebe. Osadebe is good. It was good, but it's past. But the music that he left behind, they are classic music. Good for the soul, good for the spirit, good for the mind. Osadebe was very good, man. I really enjoyed his music. Yeah, Osadebe was good. Let's let me put the earpiece on. I guess there is internet fluctuation. Sorry for the internet. Okay, let's see what we got here. Yep, everything should be working fine. Let me check out the audio to make sure that our audio quality is good. Yes. Yeah, audio is good. We're good. The audio is good. Based on what I'm saying, yeah, audio is good. I don't know. I don't know what's wrong with this internet. Sometimes this internet there's something else. Is it my mic or the internet? Let me try to see if I can fix this internet thing. Okay, I think it's good now. Let me also fix the mic. I think the mic is like, let me see if my mic is good. Because it has too much bass. It has too much bass. Mic 1 2, mic 1 2, mic 1 2. Okay. I see we might be good in this capacity right here. Let me see. Let me also check the audio. Let me increase the mic. Mic is good. Okay. Yeah, the discussion today is going to center on our healthcare. Yeah, let's see again. Yeah, let me check last mic because I think let me see if I can make it more better now. I'm trying to check the tone of the mic so that it won't have too much bass. Mic 1 2, mic 1 2. Mic 1 2, mic 1 2. I'm just trying to make sure it's going good. Okay. What is going on with this mic? Hold on a minute. Mic 1 2, mic 1 2. Okay, it's better now. Good. Okay. This is where we are. The discussion today is going to center on healthcare. Okay, let me turn that down and remove the discussion today, like I said, is going to center on healthcare. Healthcare is a major challenge in Nigeria. It's a very, very big challenge. Challenge so big that I cannot imagine why it cannot be fixed. We have, in fact, Nigerian healthcare is so bad now that we have what we call healthcare tourists. So when we say healthcare tourists, we call politicians and rich men that go outside the country in search of healthcare. But you'll be surprised that Nigeria spend almost $5 billion annually in international hospitals in search of healthcare, whereas the same $5 billion annually can be invested into the country to better its healthcare system. You see, I have said it many of a time that one problem with Nigerian economy is not that the economy cannot be revitalized. It's not that the economy cannot go forward. It's not that the economy cannot be reconstituted. It's just that there is a huge misplace of priority, especially by the elites and the politicians. So we have elites in Nigeria that can just come out and drop certain amount of money into their personal into investment and develop multiple hospitals within a city, within a state, or within a region in Nigeria. They can do that. Just these elites coming together. They can change the healthcare system in Nigeria. But then it bothers me because sometimes I ask myself, does it mean that these elites don't understand that healthcare is highly profitable? They are, in fact, one thing that bothers me in Nigeria is that most of our elites look at healthcare as a service to the poor, whereas the rich die mostly in healthcare or in lack of healthcare. Case in point, during the height of COVID, we're still in COVID, but not as it was. But during the height of COVID, Nigeria lost a lot of millionaires that could not travel out of the country in search of healthcare. Whereas we could, and these millionaires didn't die due to COVID. No, they died due to pre existing illness. I lost multiple cousins in that incident, that's in that occurrence or pandemic. These are cousins of mine that could have gotten healthcare in Nigeria. I lost a dad recently due to lack of healthcare. My own father, my mother passed away due to lack of healthcare. So healthcare in Nigeria is personal to me. It's very personal. It's so personal that I lost both parents to healthcare or lack of it thereof. So healthcare is personal to me. When I talk about it because it's personal. It's not something I'm proud of, and it's something that kills and kills. In fact, the current Nigerian president went to Germany in multiple occasions and England in multiple occasions is just for healthcare. And whenever he goes to Europe in search of healthcare or for healthcare treatment or for ailment treatment, he takes a lot of entourage with him. Just imagine how much it costs Nigeria to have to send a president to a foreign country in search of healthcare. This is the same healthcare system that could have been, this is the same money that could have been spent into Nigerian healthcare. That's number one. And just imagine how much money that could have been spent in the local businesses around that healthcare facility when a president visits. That's the state security services that are going to go with him. They have to go to restaurants inside, that's around that medical facility, to eat. That's the neighboring restaurants around it. Just imagine how much they could have spent in the system. Just imagine how much all these boutiques and stores that are going to be around that area are going to spend. It is a catastrophic issue that we undergo every time. Healthcare system is a big problem in Nigeria. It's a big problem where the poor suffer, but the rich suffer most. And I don't understand what it's going to take to get into their system to understand that developing of healthcare in Nigeria is paramount. It bothers me in a society where somebody will go to somebody's house and arrange that person's house and make it to look clean, take care of the dirt in the house, because when he came into the house was clean, looked sparkless. But the same individual that went to somebody's house and saw how clean that house was, and also participate in the upkeep of that house, that same individual will go to his or parents' houses, his parents' house or her parents' house, walking into her parents' house, see that the house is dirty, but also pull dump, bring more dump, or bring the trash from the rich man's house or from the house that is clean, brings that trash into his or her house that is owned by her parents and dump those trash that he brought from somewhere else. That's the kind of country we live in, where they will go to somebody's house and keep it clean, but come to their own house and leave it dirty. If I go to somebody's house and it's clean, I'm not going to keep it clean. I'm not going to. No, what I mean is this: when I go to somebody's house and it's clean, right? I'm not going to come there to try to keep it clean by helping them to arrange their stuff to make their house look clean. No, I will be so ashamed of myself. I will be jealous, and I will go to my house to fix my house to look just like their house. That's the kind of human being that I am. I'm not going to come to your house and dirty your house. I'm not going to do that. If I take things up, I'm going to drop it exactly where I picked it up from, because I would like to leave it the way it is. To me, this house is clean. This house is good looking. I'll keep it like that. But the sad thing is this: if I go to my house and see that my house is dirty and I don't try to make my house look like the other house, that is stupid. That is selfish of me. In fact, it's not selfish. That is crazy of me. Because selfish is only when I keep my house clean and then go and destroy somebody's house. That is selfish. But stupidity or insanity is when I go to somebody's house and keep it clean and help them to keep it clean and then come to my house and not take away trash. Don't keep my house clean. That is stupidity and insanity. Some people will say it's calamity. But it's not funny. This is what goes on in Nigeria. Like sometimes I'm in rides in Nigeria. I see people running red light, and these people have been to international destinations. Then I will look at them in their eyes and say to them, "Would you do this in the US?" They will say no. Would you do this in the UK? They will say no. Would you do this in Germany? They will say no. I say, why would you do it in Nigeria? And they say, oh, because others. I say, no, not others. Holiness and cleanliness comes from you, not others. It is you, your responsibility to keep Nigeria clean, not others. You play your part, then let the rest follow. When you play your part, hold the rest responsible to play their part. That's what you do. A single tree cannot build a forest, but you cannot as well cut off the only single tree itself. If your aim is to build a forest, you don't cut off the only single tree that is left on that land that's supposed to become a forest. You don't do that. That's my problem. When I drive around Nigeria, I see people that come to traffic and stop, and I give those people kudos. But I also see those, you know what they do? They keep going. And some of them are very wealthy Nigerians, which happen to be the most law destructive human beings on earth, non-law abiders. The most wealthiest in Nigeria are the ones that do not obey any single law. But when they go to UK, when they go to US, when I see them here all the time, they are the most respectful of law. Because guess what? They know the consequences of their actions. But their crazy ass will not obey laws in Nigeria. They will not obey traffic law or help to build a society. Why would I come to the US to spend money in hospital bills, whereas Nigeria has no hospital that anybody can be proud of? It's a shame. It's a shame. So it bothers me too much. You come to the airport, what can you say? You see all these people traveling. Oh, I'm going for medical checkup in Europe. The same medical checkup that could have been done in Nigeria for you. If you and the rest of them have invested earmarked billions of naira, billions of dollars to build medical facilities in Nigeria, it would have been better. But no, you want to brag to people that you went to Europe. You want to brag to people that you went to Europe. What is it? Nothing but to brag, to tell people that you could go to Europe, you could go to America to afford medical checkup, you could go to where they can go. And then COVID hit. I mean, a lot of you paid that price, but you still haven't learned nothing. You still haven't learned nothing. I am of the opinion that even if you set Africa on fire, those elites will still never learn nothing. It's just not in their DNA to learn anything. It's just not in their DNA at all. They don't learn. They never learn. As sad as it is, these people do not learn nothing. But it is what it is. It is exactly what it is. They don't learn nothing. And they will never learn anything. So, like I said, today's topic is on healthcare and technology. Just imagine the city of Onitsha with proven healthcare system, massive healthcare system. What do you think it's going to be? It's a whole lot of revenue. The state of Anambra State is born of billionaires, people with wealth. People with wealth, industrialized Nigerians, people that understand market, trade, whatever you can call it, anything that can generate revenue, they are from that state. But why is it that the same state lacks so much infrastructure, especially medical infrastructure? That state can produce the best hospitals because they produce seemingly the best medical doctors. They produce the best doctors. One of the best, they produce some of the best doctors in Nigeria. They produce some of the best engineers in Nigeria. They produce some of the best inventors around the world. Anambra State. But go there today. It's one of the least developed states in the whole Nigeria. With so much wealth in finance, so much wealth in knowledge, so much wealth in innovations, so much wealth in engineering, so much wealth in medicine. Anambra State. But look at it today. It's so behind. But can it catch up? Never underestimate Anambra State. They can catch up and overtake even Nigeria itself. That's how much of a strong state it is. It is the beacon of the nation. It is the beacon of the nation. They can do the undo. So today, I'm going to go in and I'm going to talk, because the reason why I'm here is to discuss one of the most mind-boggling things that has been inching me for a long time. But today I'm going to talk about it. I'm going to talk about it because I will talk about it. Nigeria does not understand the problem of not having a health care system. They don't. But today we'll break it down. So here I am. because the healthcare system in Nigeria is just tattered. But today I'm going to discuss healthcare system in Anambra State because I want Anambra State to lead in this. Because if it starts, the rest of the country will follow. That's one thing about Nigeria. When one state starts, the rest follow. But if that state doesn't start, no one follows. So let's make this happen. This is what we're talking about today. Healthcare. A healthy nation is a prosperous nation. Early diagnosis and the right diagnosis are the two necessary steps in life saving or reducing the cost of healthcare expense. You see, when I lost my mom about 20 years ago, we lost her due to lack of healthcare. We lost her due to early diagnosis. We lost her due to the right diagnosis. We were taken to my mom to hospital in order to get everything going. But what had happened was that as we tried and tried and tried to find her the help that she needed, we didn't know that the diagnosis that was done to my mom was incorrect. And in most cases, right, not only was it an incorrect diagnosis, even there was no urgency in trying to fix her. And everybody paid, and we paid our price. It was sad. It was sad. The reason why it was sad is because if that wasn't the case, if an early diagnosis had been done, my mom would have still been with us today. But due to the fact that the early diagnosis was never done, she's not here. Fast forward almost 20 years, my dad became the case. So when my dad was diagnosed of his was taken to hospital, the same misdiagnosis was the case. We couldn't get my dad to be diagnosed right because of lack of technology in our state. So when everything went the way it was, and we finally took him to Abuja to get diagnosed, it was too late a little bit because he had a lot of complications. So what we did basically was to help pay. We paid a lot of hospital bills, but due to his age, he was 82. The medical help that he needed was there, but the calamity was that the doctors that were supposed to take care of my father were absent. They were on vacation. How can a country have doctors on vacation and there are no standby doctors? No specialists. No standby doctors to take care of human health. Just imagine, no standby doctors to take care of human health. It is a very sad thing. Very sad. And 5 days of dialysis, my dad fought and fought, and the toxin in my dad's body killed him. I was mad. I was pissed. I wanted to sue. I wanted to go hard. But then I thought about it. I said, you know what? The only thing I can do is to use my platform. Mobilize people. Mobilize the state. and let's fix this. Because we as a country, we as a state, we are a bunch of laughter to the outside world. Nigerian government doesn't think what anybody says. They don't. Because you know why? Nigeria government don't give a damn. They don't give a damn. They don't give a damn. They don't give a damn because they just don't take human life serious. You may take human life serious, but the government does not take human life serious. It might be your wish to take it serious, but like I said, the government don't really would take human life serious. But the bad thing is that the people, the contractors, just don't care. Going international is more profitable to them than being in the country itself. That's what it is. So let me move to the next slide. Hospital, healthcare. In the United States and around the world, there are two types of hospitals. There is the general hospital, and then there is outpatient hospital. For the general hospital, one thing about the general hospital is this. In the US, general hospitals are mostly financed by local, state, and federal governments. Significant of money raised for projects like these are made possible from individuals or by individuals. In the US, insurance companies do contribute significantly to build a new hospital facility. Let me go back to here. General hospitals are mostly financed by local, state, and federal government. It is a very common thing in the United States. In the US, yes, that is true. Most hospitals are financed by the federal, by the local, which is the city, because they have city mayors, right? So the mayor, the city raise money in building of hospitals. The certain percentage, sometimes it's 10, 15, or 15%. And those percentage will come from taxes most of the time. Then the state will contribute because the state collects certain taxes, roads and bridges tax, which is the sticker that we have on our cars, and other revenues that the state also make money. That's how they contribute to this tax. Then the federal government, through the Department of Health and Human Services, will contribute most of the money needed to finance a huge project like this. So the money doesn't come 100% from the federal government. The state, the city and the state contribute. And in some cases, there are individual donors that will also come and contribute. Sometimes the individual donors will be like, okay, I'm going to build a certain part of the hospital, and then they will name it under their names. Sometimes they build a pedestrian, like this pedestrian bridge right here is built by a billionaire in Texas, and then name that bridge after the pedestrian, the donor, actually. And also, these donors, the hospital will do fundraising gathering or gala. During that fundraising gala, you'll be surprised. Sometimes they do raise almost 40% of the money required to build a massive hospital like this. I am going to play the video on this hospital, but like I'm saying, like you can see right now, it's a big hospital. Like when you see this hospital, it's almost 50-story high or 40-story high. It's large. It's a large hospital. It's a very, very big hospital. So those are the things that happen. And then another thing that I was going to say, let's not underestimate their contribution is insurance companies. Insurance companies do contribute significantly to the building to building a new hospital facility. Do not underestimate their contributions. The insurance company, they contribute a lot. They contribute a lot. And right now, so what I'm going to do basically, this is what I'm going to do to make you understand that hospitals in the US, but before that, so to make you see how hospitals in the US function, hospitals in the US are taken very serious. Number one is a massive revenue generation for the government of recent years. Then number two, it's also an institution that is responsible for keeping this country healthy. You see what I'm saying? Healthy. It's responsible for keeping this country healthy. Because, like I said earlier in the slide, a healthy country is a prosperous country. There is no doubt about that. A healthy country, right, is a very, very prosperous country. There is no way you're going to have a country that is healthy without the country itself being prosperous. Because what happened is this: prosperity goes hand in hand with health. You see what I'm saying? Prosperity goes hand in hand with health. So health is actually needed to keep a facility prosper. So right now, right, what I'm going to do is this. I'm going to play us a video. And this video, I want us to pay attention because you're going to see what a hospital look like. Okay. Let me get this video right now. Please watch. Okay, thank you for watching this video. Let me remove it now. So thank you for watching that video. It says a lot. So that is what I'm trying to actually. That is. Thank you for listening to that video. So this tells you how much a serious country will spend in establishing healthcare. So coming to Anambra State, like I said, Anambra State is a state that has what it takes to build this. Because I have to tell you, many a times when a state waits for federal government might not move, but you have to do the fundraising in the community. You have to invite your rich to come and participate in that fundraising. Tell them, not everything that a state's supposed to build, not everything. Sometimes you might have to bring investors because one thing about healthcare has changed, which is what I'm going to discuss later on in the slide. But right now, I have to focus on that's the necessity for healthcare. So another thing that I'm going to do right now, just like I played the Parkland Hospital tape, I want to play a tape. This is not done by a state, just a state. This is actually done by a university. Because one thing that is not done in Nigeria is university endowment. University endowment is very lacking. Because something like Nnamdi Azikiwe University, okay, has an outshoot in Nnewi, which is that's the teaching hospital. That teaching hospital, yes, Nigeria standard is good, but international standard is a mediocre. They have one of the best medical doctors, but they don't have the technology and the facility to be able to execute what they need to do. So Anambra State has to always be in collaboration with universities by us and also reaching out to the state that's to the university graduates or alumni association in order to promote those associations to contribute to endowment. And with endowment, the schools can be bigger. They can also build projects that are required in the school for the 21st century. I am discussing healthcare, but there are many things that I'm going to discuss in this throughout this podcast now and in the future that will change the look of Anambra State, and also to discuss how universities and state and companies can always be in collaboration in order to facilitate brain from the university to the companies back and forth, and also to facilitate development, to facilitate research and research and development, not development, but research and development, because RAD is the most important thing in the economy, which is research and development. Research and development comes about when universities in a state collaborate with the private companies and other institutions. Because what happens is that the institution discuss with the university what they want, and then the university in turn produces what the institutions and businesses need in order to develop and run an economy. So right now, let's go right here. This is what I'm going to do. I'm going to also come, as well as I'm talking, I'll be pulling up a video about the collaboration of a university, how a university itself can help in changing the economy. Okay, let's play this video. So as I'm waiting for this video to play now, I'm going to, so let me, in fact, you know what? Let me just play this video so that you guys can see what I'm talking about. This is gonna be good. I'm loving this. I am loving it. Yeah. Thank you for watching that. Thank you for watching that. Yeah. So what that video actually tells us is the collaboration between universities, cities, and health insurance. So it is a necessary step that is needed in order to improve healthcare system in Anambra State. So when you have University of Nigeria, University of Nnamdi Azikiwe University, okay, in collaboration with hospitals around the metro place, or building its own facility in order to develop healthcare system and access to healthcare in Anambra State. Just imagine what that will do to the health of the people. It will contribute immensely. It will reduce death rate and improve lifespan. It will increase the health of the people and also bring about revenue to the city because to the state. A healthy nation is a prosperous nation. I also do have another video that I'm going to play. This is going to be a shorter video. So this short video will also give you the inner work of what that place is. So this short video right here is very good. I like it. I played it and it was good. So I'm going to so before I play that short video, one thing about healthcare doesn't end when a facility is built. No. Healthcare also needs equipment, medical equipment, technology, best of the best MRIs, imagery. That's MRI for imagery. It also need the best and the best data analysis, because one thing you have to do is to be able to analyze an image, to be able to know what is going on inside the patient's anatomy is very, very necessary. But I don't want to go ahead of myself because I have other slides to show. But let me, you know, let me bring up this, share this screen, because that will help for us to understand what I'm about to say. Okay, go ahead. Okay, that was a good one. So, what I said earlier is this: universities cannot operate. I'm sorry. Uh, Technology, which is healthcare, cannot operate without technology. You do need technology to be able to operate healthcare. That is just what it is. You need the technology to operate the healthcare, because healthcare facility always in need of technology to be able to power its system. And also, the one thing that I like about modern hospitals today is this: they have gone beyond what they used to be. But the question is, even in Nigeria, we not even anywhere close to the power of what is today. The West is almost 20, 30 years ahead of us in medicine. But can we catch up? Nigeria has what it takes to catch up. They do. Do not underestimate the country. They do have what it takes to catch up. I do tell people all the time, don't underestimate the power of Nigeria and don't underestimate their reach to technology when they want to. Okay, then let's go to outpatient hospital. The advantage of outpatient hospital is this. Outpatient, in some cases, are the most cost efficient of running a hospital. Getting around the facility is easy, staff size is streamlined, number of patients are significantly low. But this is the disadvantage. But let me discuss the advantage. Outpatient, in some cases, are the most cost efficient, effective of running a hospital. Yes, I agree to that. The reason why is because big hospitals like this, number one, a hospital like this costs about $1.6 billion to build. That's to build and equipped. The whole thing is about $1.6 billion to build this. The same thing with the other hospital, the other big hospital, that's the University of Pennsylvania hospital that is done by the university. It's also very expensive hospital, very expensive facility to build and outfit all this is huge money. In Nigeria, it's not going to come cheap either, but it's going to be about have the cost or way less than half the cost to build that if we are going to be truthful in the building of this and not embezzle some of the money or whatever it is. You can never predict that, but you're always going to have make provision for those. Then another thing again is this. It says getting around the facility is easy. In a hospital like this, getting around the facility is not easy. It's huge. In fact, some nurses will tell you that they walk almost 10 miles a day working in these facilities. And these facilities are also in different sections. So it's not the way it is, they're not going to work all the time on it. It's different sections. So they have different sections. Even in a single level has different multiple sections, even in a single level. So those hospitals are large, but they are also their operational costs are huge. Some of them are profitable. In most cases, they are profitable. In some cases, they lose money. That's why they always have a annual fundraising to cover expense and also return on investment for those that are investors in the hospital, because they still have to pay their bonds. Sometimes bonds are taken by the state or by the city in order to build facilities like this, because not every time that they meet the fundraising goal. But the state and the federal always come by to give their contribution. But the city is where the problem is, because sometimes those cities, they don't have it. They have the ambition to do it, but not the financial chance to execute it. But what happens is that they will either raise city bonds or get investors in the city to contribute, especially when the billionaires or people that make pledge don't really fulfill those pledges. So they have to have a way of getting it done. So that's the thing about it. But so back to the slide. So another thing is staff size is streamlined. On this facility like this, due to there maybe mostly 2 levels, 3 levels, 2 levels or 3 levels, or in some cases 1 level. I've seen 1 level outpatient, I've seen 2 level outpatient, I've seen this is 3 level outpatient. So outpatient sometimes, most of the time, have a streamlined staff number. So that gets the staff to go from one point to another very easily. Moving patients are very easy, and also the size of patients that are in those facilities are very, very minimum numbers. They are very, very minimum, significantly low numbers. So they're not as patients that you would get here, which is huge. These are anywhere from 500 to 1,000 rooms. Just imagine if you even have half of that. If you have 500 patients in if you have half of the capacity, that's a headache. So Facilities like this wishes for anywhere between 10% or and 40 and 30% operation, which means your operation cost has to be minimum because the number of patients at all times are minimum. But facilities like this are also built in order when there is anything like upsurge in medical or disease, or maybe something that has to do with pandemic or maybe epidemic or something, they will be able to handle that area where the facility is situated. But in many cases, if like during COVID, this facility was outrun. And I got to tell you, they even had patients coming in from, I'm sorry, nurses coming in from out of state to come and help. And still, it was full. So they had to bring in, I'm talking about having about 2,000 nurses in one facility. There's a lot of weight on the building itself, plus equipment from people moving around. So shear force and latitudinal force all contribute to. I'm sorry. Lateral force and longitudinal force, they all under gravity, they all contribute to the construction of this property, which is lateral force um, and also gravity. They all contribute in the building of this property, like I said. So those are engineering words. I don't have to, go into that for you because it's going to be more confusing. So another thing here is number, like I said, number of patients are extremely low. That is the advantage of this. But disadvantage can be easily overwhelmed. So that easily overwhelmed, just like during COVID, right? COVID was people were hospitals were easily overwhelmed. Just look at a hospital this big was overwhelmed during COVID. How much more this? This was nothing. This was nothing. Like this was knocked out within few hours. This is already knocked out. So they can be easily overwhelmed. So COVID was able to demonstrate to us that whenever there is a pandemic, this hospital plays a part, a significant part, but almost a negligible part because the amount of patient that an outpatient like this can hold is significantly low. Not ideal for a large population density area. Yep, it's not. This is for large density. This is for a densely populated area. No, outpatient is not. This is for densely populated area. Because another thing about these hospitals, like general hospitals, almost more than half of the patients that come there cannot pay for healthcare. So the government do foot their healthcare bill. That's another thing we have to know. That is why the cost of operating this hospital come mostly from donors and the government. Even though the government contributed in the building of this, but insurance companies, right, also take a sometimes huge loss, but mostly profit because they will not operate if they cannot operate in profit. Then another thing again, limited access to technology and space, which means the amount of technology needed to operate a general hospital is huge. Is huge. Local hospitals, outpatient cannot. Even the size of an outpatient is just the size of the technology needed to operate this alone. So, certain patients or certain traumatic patient cannot be at the outpatient. They have to go straight to the general because the medical or the technology needed to stabilize such a patient, especially accident or murder attempt or gunshots of certain catastrophe, require that person is brought or even airlifted. When a patient is airlifted, they not even brought to the outpatient. They cannot be brought here. The patient has to be brought to the general hospital. Number one, this general hospital, they have a pad, an helicopter pad. Number two, they have standby technology needed to stabilize that patient. They have a first class or world class critical care room where the patient is going to be transported in order to stabilize them before they pass, in order to prevent death or get them going into shock. So those are things that are done. Okay, Onitsha General Hospital. This is the problem, and this is the benefit. Onitsha General Hospital, this is Boromi. Onitsha hospitals in Onitsha, Anambra State, and other eastern region are mostly outpatient facilities. So there is a comparison between this outpatient and the general hospital. The general hospitals in Onitsha are very small. They're not even general hospital. These are outpatient hospital. Number one, look at there is a lack of lifter. So if you go right here, right? Excuse me. If you go, oh shit. If you go right there, I gotta blow this up. So you see, those are staircase. You can't have an outer staircase like this. That tells you that the construction of this building is very poor. Number one is very poor. Number two, where are the lifts? You need a lifter. That's a huge size lifter in order to contain the stretcher. So the stretcher has to be able to get into the lifter, the lift, and not only was is the elevator. The stretcher has to be able to get into the elevator, and not only going into the elevator, the elevator has to be big enough to contain certain computer that sometimes might be placed beside the patient, and also it has to be able to contain the size of the stretcher because some of these stretchers are big. But it's so sad that the kind of development that we put into hospitals in Nigeria are just dismal. So they lack modern technology. They don't even have technology up to date. Some of those technologies are behind, but they're catching up a little bit. I gotta give them that. But they still have to change the way the facilities are being built, constrained in size due to land space and are not purchased during construction or groundbreaking. Like if you look at this, right, you can tell that the land is not big enough for a general hospital. Number one, this whole area, look at the buildings around it, is not even big enough for general hospital. It's supposed to be all not, they're supposed to be able to take a lot of land, build these hospitals very big, install a car park, and make it look good, because this is just shaming. Another problem is brain drain contribute to lack in medical doctors of ability or lack incentive to work. So medical doctors that are supposed to be in these facilities, and most of them are not even here, they're out of the country because foreign countries come and drain the medical doctors that are in Nigeria due to incentives. They do have huge financial incentives to live because of the number one, the technology that they need to operate and be able to practice their medical profession is is something that they don't lack when they go outside the country. Over here, they lack those stuff. The conducive environment is not there because of constant uh, power problem, electricity problem. So it contributes to them being that impatient and then leaving the country altogether. Then another thing again is the fact that there is no insurance reimbursement or insurance incentive. So insurance companies do pay doctors for carrying out certain operation, which has its own good and bad, but in most cases bad because it makes the doctor a commissioner doctor, a doctor that lives off of commission instead of a doctor that will practice medicine. Because the problem in the West is this, right? Most doctors in the West, I got to tell you, didn't go to medical school to save lives. Let's just be honest with that. If let me also put this real quick. If you want to be part of this discussion, let me post the invite. If you want to be part of this conversation, please do come in. Let's talk. So, like I said, the doctors in the West, most of them didn't go to school to practice medicine in order to help the poor or be of a help. They actually went there for the financial incentive. And even if you go to foreign countries, there are doctors like that too. They went in for financial incentives, and some of them actually went in so that they can get a medical and then travel out of the country to get to be able to be a medical doctor in Europe and America, where they can be financially rewarded for that. because a lot of people have motives for why they want to do something. Some people will have motives because they want to be part of the, but they want to be hero. They want to be heroes. Some people get into something because they want to help the society. Some people get there because they're going to be rich. A lot of people, you cannot fault people for the reason why they want to do something, because if you fault them for that reason, guess what, we're going to have limited supply, and if we have limited supply, that will be very bad for the society. So as much as I hate that, I also going to acknowledge that you do need the good, the bad, and the ugly in everything that you do, because these guys, yes, they may have gone into it because of the money, but they also contribute in saving lives. That's the bottom. That's the common denominator. Then another thing again that is very bad is lack of individual endowment and financial contribution, as well as insurance funding, have affected hospitals' growth and technology investment, as well as mega-sized hospitals. So I'm going. This is a lot. This is a lot. So lack of individual. Let's go from here. Let me make this easy. So lack of individual endowment. You see, I said earlier, when you don't have individual endowment, right, hospitals cannot operate without individual endowment, meaning that people have to contribute. People have to just give charitably to the hospital and say, okay, I'm giving this change, I'm giving that. Some hospitals have a huge contribution, what do they call it? A bank or whatever it is. You can give it through making purchases at certain grocery stores, or maybe at certain retail stores, or sometimes you can actually walk into that hospital and then drop money in it, or you can write them a check. So there are many ways you how individuals contribute or contribute to a hospital or give endowment to the hospital. During fundraising, they do endowment. Endowment can also be done by, let's say, if you have a university hospital, endowment can be done by students that actually attended those universities. Then lack of financial contribution, that which is and also lack of financial contribution from citizens, as well as insurance funding. Like Nigeria, insurance companies in Nigeria are dismal. The reason why I say dismal, some of them don't even pay claims. So when claims are filed, insurance companies don't pay claims. So this in itself affects the way hospitals operate, because people are discouraged from actually buying premium or paying premium, buying insurance policy and then pay the premium. People are discouraged because insurance companies sometimes do not pay claims. So this devastates the hospitals. And in fact, the hospitals don't even have insurance funding, because insurance don't even fund hospitals in Nigeria. They are mostly interested in collecting um, premiums and not doing anything. So Nigeria, Anambra State itself, even a state can do it. A state can literally go after insurance company, destroy insurance company, pursue an insurance company out of the state if they don't perform. Which means if it's a non-performing insurance company in terms of um, paying claims, yeah, a state can go after them and ban them from ever practicing in that state. So another thing again in that effect is also due to this, there is no really, due to insurance companies not doing their best, hospitals don't even purchase technology or invest in technology, and also being able to expand those hospitals and make them mega sized hospitals like this right here. Some of the contribution that came into building these hospitals are actually done by a good percentage of the funding is actually by insurance company. But because insurance companies don't contribute at all here, most of this is done by the state, not even the federal. This is mostly the state. So this facility lacks these fundings: federal funding, city funding, insurance funding, and endowment. Four fundings are lacking here. Just imagine if those four fundings contribute to this hospital, it would have been a big giant hospital. Let's be honest with that. then medical prediction from medical device. Now we're talking about tech. So like I said, technology cannot be denied at all. You need technology to run a world-class hospital because number one, you cannot operate or predict a patient's illness without first doing adequate MRI with the latest technology. You scan the patient with the latest technology. Do data analysis with the latest technology. Do X-rays with the latest technology. There are technologies that are in color today that will give you far much more detail of a patient's body or anatomy better than the white and black imagery that were done in the past, because most Nigerian imagery are still done in non-color image or detail. This is what we're talking about. You can be able to analyze, like you see how this patient's call is being analyzed to understand the movement of the brain, to understand brain partition, and understand if there is any issue pertaining to the or any traumatic or maybe cancerous issue going on with the brain, or to see how the brain itself functions. This can be done using the latest computer, using the latest technology, using the latest MRI to scan the human body, human anatomy, in order to understand how what is going on with this individual. Okay. Then, still on that, powering up to meet the demand of today's healthcare technology. Healthcare technology is an technological, including medical device, IT system, algorithm, artificial intelligence, cloud, and blockchain, designed to support healthcare organizations. That is true. Look at what Ramsey University says. It says 5 ways technology in healthcare is transforming the way we approach medical treatments are electronic healthcare records, personalized treatment, telehealth, surgical technology, artificial technology, and augmented reality. So let's do this. Electronic healthcare record, meaning that when a patient comes into a healthcare facility and blood is drawn, the patient's specimen or whatever is needed to go and find out what is wrong with the patient is done. When everything is done, you need to have that patient to have access to their medical records, and they can do it with their cell phone, with their computer, so they don't have to come to the hospital, except if it's a very critical thing that a doctor has to be there to analyze. Then it's okay. But if it is the doctor just have to summarize everything that has been, whatever report that the patient has received so far, or in conclusion, then the doctor will have to invite the patient to say, you know what, we went through everything, it seems like you're okay, nothing is wrong with you. Most cases, up to today, doctors prefer to talk to the patient face to face, because in order to have that human touch, a human effect. And then remember, personalized treatment. So this personalized treatment, this is what I'm going to do. For the personalized treatment, I'm still going to go back again to a video that we had earlier. Okay. So personalized treatment, you got to give people sense of belonging. This is what personalized treatment does. When you give people sense of belonging, then it gives them joy, it gives them happiness, and also it makes them understand that their health is being taken serious. But when that is not the case, the patient itself doesn't have any sense of belonging. They don't have any sense of belonging at all. So it is very, very critical that a patient health is taken very serious, especially when they have to understand that their health is their wealth. I'm telling you, people do people do take their health very serious, and in so doing, it's very, very vital that hospital makes that as an experience for them. We have different types of humans, and you just have to treat everybody the way they want to be treated. I'm just playing this again so that you see how personalizing human health is so important. So this will tell you a lot about the personalization of that's just let's go flow with it. So I'm going to stop, right? I'm going to pause this. So what I'm trying to say in essence is this, right? Personalization is very, very critical. You see, people, like based on what I was saying earlier, let me go back to the slide. So if you look at the slide, right, the slide tells you that personalized healthcare, personalized healthcare, right, is very, very important. You see, personalized healthcare is very, very important because what happened is this: people love sometimes certain depend on wealth. People love to be treated good. I'm telling you, some people want their personal space and they can afford it. They want the best healthcare that they can get. They can afford it. So if you look at that University of Pennsylvania and so many universities in what do they call it? So many hospitals in the US, right? They do have personalized care because they know that those people, those individuals can afford this personalized care. Then, and if they can afford it, you have to deliver it. You just have to deliver it if they can afford it. You just have to deliver it. That's what it is. So if you also look at this real quick, check this out as well. Telemedicine. Yes. Telemedicine. I got to go back to that again because telemedicine is very, very important. It is the new thing now. Telemedicine is the new thing. We shouldn't underestimate it. Just like people like to personalize their treatment, people love telehealth. You see that? They want everything to also be done in telehealth. So what I'm going to do as well, I'm going to put us back because telehealth is that important to some people. So check this out. That is the new way to do medicine too. Yep. So another thing that I'm going to discuss is this for the 7 operating rooms. In most hospitals in Nigeria, in Onitsha, right? Yeah, Julian. Hi, Julian. Hello. Yeah. Yeah, hello. So in most hospitals in Nigeria, right? This The operating rooms are usually maybe one or two or something. They don't really have that much of an operating room. And it's so sad. It's very, very sad. I'll tell you, it's very sad. Even in some of the rooms, right? Like when my dad was at the hospital, at the government, federal government hospital, I couldn't believe everybody around it. There is no privacy. There is no privacy at all. Like you can't even be in the hospital with your kids. Everybody's around you. Just imagine what is going on in that. Just imagine everything that is going on within. There is no patient privacy most of the time. Even when there are patient privacy, it's just not adequate to, like, I got to show you some beds here. Are they improving? I got to tell you, yes, they are improving, but they could do better. They could do better. And that's what we're striving on. Because, like I said, Nigeria lacks, like, Onitsha still lacks a lot. Like, you guys see what I'm showing, right? I'm going to remove that so that way I can do it in a way whereby I can concentrate in doing one thing or the other. So if you look at it, right, let's go to the share screen again. Yeah. So if you look at it, you see, you don't see this in the West anymore. It's very hard to see this in the West, where you have clusters of beds in one facility with fans running. No, fans are not made to kill disease. Fans, they spread disease. So you have to have air condition in a room to be able to monitor. In fact, the governor that built this has been to hospitals in the United States. This governor lives in the US and he knows he can't even see this in the US. He can't. And it bothers me how our people that have access to medical in international destinations or have been to international destinations are the ones that are building crap because they don't value the lives of our own people. They don't. Let's call a spade a spade. They do not value the life of our people. They don't. They don't. They just don't. It saddens me. They don't. They don't. Hopefully, we can start doing better because we need to do better. We need to do better. I'm also going to show this video right here because, like I said, sometimes some of them do good jobs, some don't. Oh, I got to call a spade a spade. Like if you look right here, you see these. I have one to show. It's let me pull it up. Medical is personal to me. Like you see, this is a hospital in Nigeria, Oriental Hospital in Onitsha. Yeah, you can have that right there. That's the thing about Nigeria. Oxygen rooms supposed to be oxygen. It's supposed to be far away. There's supposed to be a connection somewhere coming from a connection somewhere that has a room full of that has oxygen tank like this, and from that room, this pipe there are pipes that will come from that room into the necessary rooms that's supposed to have those oxygens flowing. So the oxygen will flow through a pipe into into a tube that will then connect to come straight to be able to be connected to the patient. You can have oxygen tank right there. But guess what? Overall, they're doing a good job. They're in the right direction. Hopefully, Nigeria will have a codes that enable hospitals to be built, because right now people are just building whatever they want. Okay, going back to my because I don't want to lose what I've been doing. So right now we got to go back to this in order to finish up for today. So surgical technology, like I've explained, is needed to be able to operate and treat patients very well. Like that video that I was looking at, let me show you something on that video, because I also have to be able to play this. So it's actually explained, because these are part of technology. You have to give, when it comes to hospitals are supposed to be where patients come to get well, not where patients come to die. If it's where patients come to die, then just let the patients be at their houses and die there, not come to the hospital. So yes, it's 47 surgical rooms. That's a lot. Let's be honest. That's a lot. That's a whole lot. I'll be honest with you on that one. That's a lot. Artificial technology and augmentative reality. This is it right here. So you have to be able to see the image of the patient that is being treated. You have to be able to see, to use the augmentative reality to be able to draw without even going into the patient or being invasive in that patient or using invasive procedure. You can use MRIs to be able to obtain these details. And these things are done because of AI. But humans can do it because we don't want AI taking our jobs, right? These are things I'm going to discuss as well. But this is the mother of all: revenue. This is where I'm going to stop today. The United States government by 2027 is going to have a revenue recycle management of $135 billion. US is a country, excuse me, with 300 million people. Nigeria is 70%, 65 to 70% the population of the United States. Then Nigeria healthcare is abysmal. The reason why, they still don't understand or haven't realized that healthcare is a massive revenue generation. It's also a massive cost bearing. You don't need healthcare to make your society prosperous, but you also can draw a lot of revenue from healthcare, especially for facilities that are around that healthcare: restaurants, movie theaters, amusement parks, so many things that you can have around the healthcare system that can contribute to the economy, independent of that. I'm talking about indirect jobs and indirect revenue. to a community. As the industry continues to transform from free for service to value-based care reimbursement. This is why doctors leave Nigeria. This right here. They are looking for value-based care reimbursement. This is also the reason why a lot of people that don't care about medicine went to medical school. They want money. They want to be paid. They see the money, not only the patients, but they also do treat patients. Healthcare revenue recycle management must adopt accordingly, which means it cannot be all about profit, but it also has to ultimately be all about the health of the citizens. Like I said earlier, a healthy country is a prosperous country. Healthcare revenue recycle management begins when a patient makes an appointment to seek medical service. The process ends when organizations have collected all claims and patients' payments. Meaning, as soon as a patient makes a call, there is a law that begins. That's the cycle of healthcare management. The patient has to come in. The patient has to be cared for. The patient has to be treated. And the patient, guess what? Has to be taken care of first before when the patient is well. Now, the next thing that comes in becomes collecting the bill. Because the bill has to be collected, right? That is why, and that is the end of everything. Because the problem in Nigeria today, no, they want to collect the bill before treatment, but you can't do that in advanced countries. You just can't do that. But Nigeria also, you're not supposed to do that in Nigeria. It's because the laws are not enforced. The laws are not enforced. Because if the laws are enforced, right, the hospitals don't have, either you have a hospital or you close it down. It is what it is. It's either you have a hospital or you close it down. Because you cannot have a hospital and then treat patients like crap. Nope, you can't do that. You can't have that. You just can't do that. Because you're not supposed to do that. You are dealing with human life. You are not dealing with some disposable person. No, you're not. You are dealing with human life. So right now, I'm going to discuss what the most important thing here in this discussion, which is why hospitals operate. Why hospitals are in business. The reason why hospitals are in business is something that we all know, and that is called what I just said right now. Let me bring this up again. Healthcare revenue cycle management. Let me go back because it is what I want to discuss now. Healthcare revenue cycle management. So for that healthcare revenue cycle management, we have to discuss this right here. Okay. Number one, a patient, the first thing you do, appointment scheduling. You schedule that appointment that the patient should come in. When the patient comes in, then you do what they call patient's registration. After the registration, you do eligibility and benefit verification, which means if the patient comes in with an insurance, right, you want to find out if that patient is eligible, if the patient's insurance is good, or if they are eligible for certain benefit, which means Medicare and Medicare, right? Then utilization review. The hospital will make utilization review. refer on an authorization that will take effect. And then after that, describing changes. If there is any changes that has to be done on the patient application, it has to be done. Then coding and billing. You have to put coding and billing in place. Then charge posting. You post after everything is done. You have to post the charge. You see what I'm saying? Post the charge of the patient bill. Then submitting claims. If the patient have insurance, or if he's going through Medicare, it's not doing out of pocket, right? You submit the claims of the patient to insurance company or to Medicaid. That's in the US. Clearinghouse denial. If there is any denial maybe if the insurance company denies the claim, now you have to clear house for denial. Then now you have to post the payment posting to the patients. Then denial management. Then secondary filing. You do a secondary filing. Then if you do a secondary filing, that means the patient is not paying. Now you do account receivable. You send it to account receivable, because the account receivable would then take, which is like collection agencies, right? They have to know that there's an account receivable before collection. So the account receivable will then receive it, and then guess what they will do? They will write off that, and then appeal procedure will follow to try to appeal maybe to insurance company or to the patient to pay. If they refuse, now patient billing and / collection. Now the collection agency will then institute collection from the patient, either through the court system or through collection agency, or by adding it to the patient's credit. So that is the revenue cycle management. Now I got to go back to one serious thing now. So the thing that I'm going to right now is also the slide. I'm going back to the slide because I'm about to finish this program. So on the slide right there, then it says, healthcare revenue cycle management begins when a patient makes an appointment to seek medical services. The procedure ends when organizations have collected all claims and patient payment. That's it. Then, in a simple term, healthcare organizations must stay in the black and maintain profitability. This is the problem. This is why medical facilities don't run well in Nigeria. To see success with revenue cycle management. That's right. Facilities can employ several strategies to maximize the revenue cycle and ensure timely payment. Yes. Because, like I said, and as it is stated earlier, as the industry continues to transform from free for service to value-based care reimbursement, that is it right here. It's in simple terms, healthcare organizations must stay in the black. They can't be in red. They have to stay in black. In the black means they are making profit. When you use a black pen, that means there is profit. When you use a red pen, that means there is loss. Whenever you see that red pen in any business revenue chart, the CEO panics. Whenever you see those black pen in the revenue chart of a company, the CEO is excited because guess what? His incentive is coming. And maintain profitability to see success with revenue cycle management. Facilities can employ several strategies. They don't give a damn. They have to get their money with every means necessary. But when they can't get that money, then it becomes a loss. They can't do nothing about it. That's how it's operated in the West. So thank you so much, guys, for listening. I got to tell you, I really enjoyed doing this broadcast today. Because the broadcast for today, I knew it was going to be this intense. I knew it was going to be this exciting. Because if there is anything that I've always been inspired, is medicine. Not to be a medical doctor, but to see proven medicine in Nigeria. Because I got to tell you, we need it. My parents are no longer today because of poor quality medical. But if we had serious medical in Nigeria, guess what? My both parents would still be alive today, enjoying their grandkids. My mother never met any of her grandkids, but my dad met a lot of his grandkids, and we are grateful for that. But they could have lived more longer to see their great grandchildren. My grandmother was so lucky. She saw her great grandchildren. My grandfather, from my paternal side, saw a few of his grandkids. My grandmother, from my paternal, saw a lot of her grandkids. She died almost 80, about 80 or 80 something. I don't even remember her age. I know she was old. Then my maternal grandfather saw a couple of his grandkids. He died when he was in his late 70s, about to be 80. Then my maternal grandmother was 102. She saw her great grandchildren. If she was still alive today, she would have seen her great grandchildren, great great double great grandchildren. She would have seen it because one of our great daughter just married. So she would have seen her great grandchildren. That's how much my grandmother lived. Her medical attention was done on time. So the timely medical checkup is very necessary. So I am very happy to have done this presentation today. I got to tell you guys, I'm getting better because this presentation, compared to the ones that I've done in the past before now, wasn't as, energetic. Even though there was nobody that come up. In fact, I really wasn't expecting people to come up today because I wanted to be able to do this presentation. But in the next podcast, which is tomorrow, I might end up bringing people up. I know if I start at 5 o'clock London time, 5 o'clock Nigerian time, and 11 o'clock Central Time US, and 12 o'clock, that's 11 a.m. Central Time US, and 12 o'clock Eastern Time US, and 9 o'clock Eastern Pacific Time US. People usually do calling at those times, especially my people in London. They do calling, but that's okay. But as the channel grows, I'm hoping to see people call in. But I got to keep talking about the development of cities, development of businesses, how business is supposed to run, how you're supposed to be able to do your business and do it efficiently well. Like right now, I'm glad that I've been using video aid to do this presentation because with video aid, it's much more easier to communicate with people. So you're going to be getting those video aids from me. It's going to be good, more detail. And guess what? I am looking forward to discussing with you guys. Thank you so much. And may you have a great day. Goodbye. Uh,
People's Club. Oh, yes, Lobodo. Ndị People's Club odogwu. Ikiriki adagbukwa n'anya odogwu. Ikiriki adagbukwa n'anya n'ọkụ si adị o. Ikiriki adagbukwa n'anya o. Igbe anyị nọ. Oluwenu na omume. People's Club, Mamanu. People's Club, Amakanu. Umwakuleza kwa zino bele mwanu. Anawaza kapu mwajezenu. People's Club, ikudezenu. Na mwamorani, agwa zobele mwa.
Okay, good night, guys, and good day, guys, and let's talk some other time, okay? Yeah.